Hi everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and a headache doctor. Today I'm YouTubing on a subject of the FDA and triptans and SNRIs and SSRI as a warning, and the warning really is wrong. So triptans are in 2020 the best acute therapy drugs for migraine. Migraine is present in 25% of women and in 6% of men, and for women, migraine is the most common medical problem of all problems, more common than hypertension, diabetes, heart trouble, or arthritis. Untreated with only over-the-counter drugs like supplements, NSAIDs like Advil or Aleve, or drugs with caffeine such as Excedrin, migraine is a tremendous burden since it is very disabling and one of the most frequent reasons for a visit to the emergency room. So the FDA and triptan SSRI and SNRI warning is wrong. We're going to talk about that. Triptans involve blocking the release of a specific neurochemical, which is 5-HT1D. The 5-HT receptor, which is active in the triptan SSRI SNRI relationship, is not a 1D receptor. Therefore, triptans do not set off the serotonin syndrome. Now, SSRI refers to selective serotonin receptor inhibitors, and SNRI is covered here also, and it's a term that means serotonin norepinephrine receptor inhibitor. Both of these medications are indicated for treating depression, anxiety, and panic disorder, and they've been included in the FDA Triptan warning. So what does the official note from the FDA on triptan say? The FDA states on the PI, now that's doctor talk, pharmaceutical talk for product information sheets. One little thing that comes in drugs, this little piece of paper, it's all folded up, tiny writing, most people throw it away. On that, it's a legal document regarding the drug. The PI states for all triptans that there's a possible triptan SSRI, SNRI conflict and the rare risk of development of serotonin syndrome in some patients who take these drugs. Well, what have U.S. migraine experts said about triptans and SSRI drugs and SNRI drugs? In a recent review, most physician migraine experts did not recommend that triptans and SSRIs or SNRIs be discontinued unless symptoms arise. Well, what is serotonin syndrome? The symptoms of serotonin syndrome are restlessness, hallucination, loss of coordination, tachycardia, changes in blood pressure, fever, nausea, vomiting, or diarrhea. The risk is estimated to be less than 0.03% of patients, and life-threatening events are less than 0.002%. Who figured out the truth about using SSRI and SNRI drugs with triptans? Well, Dr. Randy Evans, a headache neurologist in Houston, was the man who investigated the problem and figured it out. Dr. Evans found that the FDA warning was wrong. Triptans, as I said, block the release of 5-HT1D receptors, which are part of the migraine cycle, just stopping the release of inflammatory neurochemicals, which are neurokinin A, substance P, and CGRP, which cause the migraine headache. Dr. Evans obtained information about the triptans utilizing the Freedom of Information Act and was able to find that the 5-HT receptor active in the triptan SSRI SNRI relationship was not a 1D receptor. Because of this, there's little risk of triptans setting off serotonin syndrome when given conjointly or at the same time with SSRIs or SNRIs. Dr. Evans and other writers wrote another article which questioned whether patients who, on the basis of the FDA's warnings, actually had serotonin syndrome. So they went back and looked at the paper and analyzed the patients. Has the FDA changed the report in the original triptan PI? The FDA has never changed the original statement. There was a problem in the use of triptans that caused serotonin syndrome. Has the FDA has this warning been a problem in the practice of migraine in America? Well, pharmacists filling prescriptions for patients take triptans and SRIs, SNRIs. It comes up on a computer, gives an alert and a warning to the pharmacist, and he has to send a notice to the treating doctor. And that's been done millions of times across the United States. A little piece of paper, you're supposed to put in the chart, and I can recognize this. I get most headache doctors don't do much about it, they just file it. Neurologists' offices across America are frequently notified about this possible triptan SRI SNRI problem by their patients' pharmacists. This is a meaningless procedure. Many patients with migraine have been cautiously put off by this FDA mistaken statement and have declined taking a triptan, which is the best drug for acute migraine therapy, and these people have suffered greatly. If a patient asks me about it, I refer them to this webpage article that I have on the internet at www.drmigraine.com, and also quote Dr. Evans' work published in Headache by the American Headache Society. So in the journal Headache in 2010, a group of migraine experts got together and they commented on it. I'm going to read the article title here. It's the FDA alert on serotonin syndrome with the use of triptans combined with selective serotonin reuptake inhibitors or selective serotonin norepinephrine reuptake inhibitors. And it was an American Headache Society position paper. Big deal. So, in 2006, the U.S. Food and Drug Administration FDA alert warned about the potential of life-threatening risk of serotonin syndrome when triptans were used in combination with SSRIs or SNRIs. So what they did is to make a diagnosis of serotonin syndrome, there have been doctors who established what are criteria for making a diagnosis. One of them is called the Sternbach criteria, and the other one is the Hunter serotonin toxicity criteria. So there were 29 cases used as the basis for the FDA alert, and they were assessed in addition to more recent public cases of 11 cases of serotonin syndrome resulting from monotherapy of just using triptans alone, and one report of combination serotoninogenic agents. Evidence evaluated according to the American Academy of Neurology Clinical Practice Guideline Process Manual. This is all big deals, very precise and organized well. Results. Collectively, 40 case reports are available in the literature for subjects receiving either combination of monotherapy, that means a triptan alone, or triptan with serotonin agonists, as we mentioned. Of the 29 cases used as the basis for the FDA alert, 10 cases actually met the Sternbach criteria for diagnosing serotonin syndrome, but no cases fulfilled the Hunter criteria for serotonin toxicity. One case, published since the original report, does not meet either criteria, and subsequently reported cases involving triptan monotherapy include insufficient details to confirm a diagnosis of serotonin syndrome. So you can't even be certain that the FDA had enough patients with serotonin syndrome when they made this statement. The recommendations were, the currently available evidence does not support limiting the use of triptans with SSRIs or SNRIs or the use of triptan monotherapy due to concerns for serotonin syndrome. However, given the seriousness of serotonin syndrome, caution is certainly warranted, and clinicians should be vigilant to serotonin toxicity symptoms and signs to ensure prompt treatment. Healthcare providers should report potential cases to MedWatch and consider submitting them for publication. I'll make another comment just off the cuff here about this subject. Doctors and pharmacists are hammered with lots of busy work and forms and papers to fill out and sign. And this is a big example of one of the most common ones. We don't need it. Aren't doctors being stressed and driven out of practices by electronic health records and all the government rules we've got? Well, here's another one. So, God bless all you persons that have migraine. Follow me on YouTube for other migraine articles. Subscribe down there, please, so we can follow each other, and I will see you on another talk.